First off, first things first, as a proud mother of 2 Topeka High graduates, hoy hoy mighty Troy. That's right. And thank you to the cruise line. Every year I think you can't get any better, and every year you are better. And I'm going to go home and email my sons that they weren't in the best years. This is it. So thank you for being here. Well, we wouldn't be here today without the assistance and the help of Frankie. And Frankie Millie has been instrumental in all of these events, and certainly in my awareness of Meningitis Angels. So Frankie, we can never repay you enough for what you've done. I know it was a tragic situation that brought you to create the Meningitis Angels, but out of that tragedy has come so much good, and we can never ever repay you for what you've done for all of, I was going to say Kansans, but I'd say all citizens of the United States. So thank you very much. So, in 2006, I was here as a legislator, and we enacted House Bill 2752. Someone here named Andy might have been one of the people that testified about that, and so thank you to Andy for making us have a real person to put a face to the legislation we were enacting. The bill required all Kansas colleges and universities to have policies and procedures in place that would require all incoming students who reside in student housing to be vaccinated for meningitis. That law went into effect on 7/1/07. And as you've heard, the CDC says that there's approximately 1,000 to 1,200 cases of meningococcal disease each year in the United States. Even when they're treated with antibiotics, 10 to 15% of these people die. Of those who live, another 11 to 19% lose their arms or legs, have problems with their nervous system, become deaf or have intellectual disabilities, or suffer seizures or strokes. Studies have shown that college freshmen who think that nothing will ever affect them, who live in dormitories, are at an increased risk compared with others others their age. I was a proud sponsor of that legislation in 2006, and again, I want to thank Frankie Millie, for the founder and National Executive Director of Meningitis Angels, for bringing awareness of this week to Kansas. Meningitis Angels educates the public, health professionals, child care facilities, schools, and universities on not only meningitis, but other vaccine-preventable diseases and preventions, including vaccinations, through personal stories, educational brochures, posters, and videos. And if you haven't been on the Meningitis Angels website, I strongly suggest you take a gander. You can Google it. It's real easy to find. So it's with great pride that I sponsored this resolution declaring April 16th through 20th as Kansas Meningitis Awareness Week. Thank you so much to the Meningitis Angels, and particularly Frankie. So with that, I want to present this resolution. Also want to thank the individuals with the sign holding behind me. They have the hardest job here today. All right, here you go. And these are the angels that this is for. And this is from the state of Kansas. We read it on the Senate floor before we recessed, and it declared this week, and we appreciate you all coming and driving through some hazardous weather. Welcome to Kansas to get here. Thank you very much. Okay, get in here. Somebody come on my other side. I feel left out. Come on over here. All right. Yeah, there we go. All right. How's that? Yeah, because I'm in it, but no. Okay. Thank you so much. Precious, you are here. All right.
Cool, hi, Kansas. I am Frankie Millie, and I've probably got me to sing. I'm so loud. Shut up a minute. I am Frankie Millie. I am the founder and National Executive Director of Meningitis Angels. I founded Meningitis Angels in memory of my only child who died with meningococcal disease, and that was almost 14 years ago. And today I have with me several of my angels. But first I want to take a moment to say thank you You're awesome. And if you ever decide to leave Kansas, I know a job for you in Texas. And we all have worked hard, and you guys have done a really great job here in Kansas, and the health department, the immunization branch, you guys do an amazing job. But you know what? We can all do a much better job. We've worked really hard over the past years to make sure that college freshmen were educated and vaccinated. In many states now, in Texas, as a matter of fact, we just passed a law that requires all first-time college students up to age 30 to be vaccinated. And I'm privileged to have helped write some of that language in that bill. So we can do a lot more. We know that the most vulnerable now are about 11 to 18-year-olds, but even more than that. And we have vaccine, and we have recommendations from the CDC for that age group. So it is only right that we get those kids immunized between that age group, so when they go to college, they're already prepared for college. And many programs like Vaccines for Children pay for those vaccines for children that can't afford them, don't have access, up to age 18. So if we can get those kids, you know, it's really important that we have mandates in place to make sure that kids get immunized and that the education is out there. And that's what we're here for this week, is to make sure that your kids and your parents are really immunized. But there's one more group, as they mentioned before, and that's infants. Infants account for about 35% of the cases of meningococcal disease in the country. They are at high risk. There are vaccines on the horizon for children as young as 2 months. As those vaccines become available, we will be educating, and we will be testifying at CDC in hopes that they're going to recommend those vaccines for our kids to be protected. Because when infants get meningococcal disease, they mostly don't make it. And the ones that do are severely debilitated. They lose faces, arms, legs. They have to have kidney transplants. They have severe brain damage. They're blind. They're deaf. No child in America, I don't care what age, should have to suffer from a vaccine-preventable disease, especially one so devastating, when we can prevent it. It's the right thing to do. I would like to have a couple of my angels come up here. Miss Harley. Harley had meningococcal disease at age 3. She lost a leg, she's deaf, and she lost some fingertips, but it doesn't hold her back. And when she doesn't want to listen to me, she turns off her hearing system. So I can tell when she's done it, though. She kind of gets this blank look. And then there's my Johnny Angel. Johnny also had meningococcal disease at the age of 3, and you can see Johnny lost his legs. He lost part of an ear that had to be reconstructed, some fingers, and Johnny, I'm proud of Johnny. He's in ROTC. He is just an amazing young man. We love our Johnny Angel. They've been with me since the beginning, since right out of the hospital. And last but not least, well, Amanda's over there, but she's too old to be introduced, she thinks, anymore. Amanda's actually been with Meningitis Angels for 10 years. She was a college student who contracted meningococcal meningitis. Carrie, can you come around on this side? Carrie's been with me since she was 5 years old. She was in a coma for a long time, for many, many weeks. She went into kidney failure. Her kidneys came back, thank God. Carrie is pursuing her college degree now in music school. She wants to go to Berkeley School of Music in Boston, and so we're hoping that she's going to get to do that. But we're really proud of our angels, and we are not just an awareness group. We are a group that takes care of our kids. And so, Carrie, with that being said today, you don't know this, but Meningitis Angels is presenting you with a $5,000 scholarship to the college of your choice in memory of Ryan and all the other angels and in honor of the Earthbound Angels. So we're so proud of you, baby girl. And I hope as we move through this week, a lot of lives are changed. I hope a lot of kids get vaccinated. Because no teen, no child, nobody wants to see their infant go through what these kids have gone through. And what I as a parent have gone through is in burying a child. No child should suffer, not from this disease. We have two of we have a sister over there to Johnny who's very wise. Barry, you want to come on over here? Carrie, they're going to do the vaccinator rap song, which I actually helped to write, or actually did most of the writing. We tried with Carrie's cousin, but like her, he doesn't have much rhythm. I have the only black child in America who cannot rap. So, but she sings like an angel. That's why she's going to Berkeley School of Music, okay? But they're going to do the vaccinator rap song, and Sam and his cruise line, we're going to be with them later in the week. We're going to be doing some video work for our website and for YouTube and the health department. I want to say a special thanks to Senator Smith, the health department, the school districts, everybody. Sam, your cruise line is amazing. I don't know why. Can you just change your name? That would be really easier on me. I'm old. I can't remember things. And to my team that's here, Andy, whether you like it or not, we love you. You're amazing. We're adopting you in, whether you like it or not. And to everybody here who's worked so hard this week to make all of this week happen. This is just a kickoff. We've got a lot to do this week. So without further ado, we're going to get this. Sal, your team is going to join with them. You guys go for, and if you did anybody